I got a vasectomy for my strong principles around why we should not bear children, and I wanted to walk my talk, especially, and it's a very simple, easy, and frankly rewarding experience that I put off for too long due to the pandemic, and decided to go ahead to live out basically what I'm doing here right now. Having a vasectomy definitely feels like a relief because whatever my level of sexual activity is, knowing that the odds of having any sort of procreative side effect are almost nil. Obviously nothing is nil, but as close to nil as one can get in this world. It's something that's weighed on me for a long time, even before I thought about getting a vasectomy. I did get a scalpel vasectomy, so there was a 30 seconds to a minute of having to get the anesthetic applied. But other than that, for a couple weeks, there was some minor aches and pains that was taken care of with some ibuprofen and some ice. At this point, 3.5 weeks later, nothing. We need government subsidized vasectomies, tubal ligations, hysterectomies, and abortion on demand as soon as possible. We'll not stop fighting for it despite how fucking backwards this country is. My motivation for volunteering with Stop Having Kids is because I think this is a needed, underheard, vital message on so many fronts, and I have enjoyed it. I like getting into people's consciousnesses, raising awareness, planting seeds. I'm not doing this because I think 8 billion humans are going to stop procreating, but to even get a few people to consider and to not have children is a big win for that non-existent child. And I've had like 75 to 90% positive or neutral reactions, so yeah, totally worth it.
I had a vasectomy 14 years ago. I fully support your goal.
Oh, thank you so much.
Nice, that's awesome. You're gonna love it.
Having a vasectomy is a permanent decision. But as a patient told me once, having children is also a permanent decision. So it is very important that when somebody has satisfied his fertility, if that is what they want, to have children, and they think about not having any more children, they choose something that is practical, that is simple, that has the lowest morbidity and has the highest impact. Morbidity being less risk of complications. But if you don't want to have any children because you are inclined to live your life childlessly, which is totally fine, and you decide to make a decision for a procedure that is going to allow you to fulfill those goals, a vasectomy is an excellent option. I get it. I would love to be able to say that women have a similar option that is as simple, as quick, and as safe as a vasectomy, but they don't. They have a tubal ligation, which they should be able to access that procedure as well without any judgment or any restrictions. But when it comes to something simple, to fulfill that goal of a childless life, especially if you're in a couple, a vasectomy is an excellent option. A vasectomy is nothing but the discontinuation of the vas deferens, which is a tiny little tubule that brings the sperm that is produced in the testicles up into the urethra, which is the tube that brings the semen out through the penis. So 95% of what is produced, or 95% of what comes out when we ejaculate, comes out actually of the prostate and the seminal vesicles, which are two glands that are deep into the pelvis. and they actually produce all this liquid that nourishes the sperm. So when you ejaculate, only 5% of what comes out in the ejaculation is the sperm, and that is coming from the testicles. So the purpose of the vasectomy is to not allow the sperm to get into the semen so that you cannot impregnate anybody. You cannot cause a pregnancy. We accomplish that by cutting the communication and by cutting the vas deferens. So when you think about that, then cutting that communication does not affect the function of the testicle. The testicle will continue to produce the sperm, will continue to produce testosterone. There's no changes in the behavior of the individual. And because we're doing only that, there's not even effect on the sexual performance of the individual. The difference with the other alternatives, which are the withdrawal method, which by the way is a terrible thing to use as a method of contraception, and condoms, is that this is permanent. This is a permanent decision. This is a permanent procedure. Can it be reversed? Yes, it can be reversed. And the longer it goes, the more time passes by from the vasectomy, the more difficult it is for it to be successful if you reverse it, but it can be reversed. Now, it is important that people understand that because it is reversible, it doesn't mean it's just that simple. It's not like turning on and off a switch. We would love to have something like that, but it turns out we don't have anything that can allow us to do that. And it is important to understand that because the rates of success are variable with a reversal, and the cost is high. We're talking about a procedure that can cost somewhere between, if you find it very cheap, could be something between $5,000 and $10,000 out of pocket, because insurance companies don't cover that, with a rate of success that could be very variable between 60 to 80%. And we're talking about 60 to 80% of having sperm again into the semen, which does not translate necessarily into a pregnancy. So it's a gamble, right? It could be a $10,000 gamble for you not to get the pregnancy when you're trying to get it again after you reverse that. So it should be taken as a permanent contraceptive. And obviously, the other thing is that vasectomies, as well as the withdrawal method, will not protect you against sexually transmitted diseases, which is something that condoms definitely do. There is a lot of myth surrounding vasectomies. I usually like to tell patients, I did my own vasectomy years ago. I'm not going to do anything on myself and perform something on myself that will put me at risk of not having adequate sexual performance, because we all like that. So yes, people are concerned about the levels of testosterone. They're concerned about their erections afterwards, and there is no problem with that. And some people who like to read more have concerns about association with other diseases, because there was some data in the past that suggested there was a potential association between prostate cancer and cardiovascular disease and vasectomies. But the American Urological Association has shown that those were not causation. There's no plausible explanation for any causation. So in places where you see a high rates of vasectomies, we don't necessarily see high rates of prostate cancer, like in Canada, for example. Nothing different. So there should be no concerns on those issues. There's this thought that vasectomies equate castration, and this is not true. I don't know if necessarily, at least in the area where I am, which is a very rural area, it's just an agricultural area anyways. I mean, it's the pantry of the United States. We're in the middle of the country. If people necessarily, because of what they do, associate castration with vasectomies. But in general, you can see that a lot of misinformation happens because of that. There's this thought that vasectomies will imply that you will have your testicles taken out. And obviously, we need to clarify that. There's misinformation because of the fear associated with the potential sexual effects afterwards in terms of the vasectomy. And there's misinformation because in general, men don't talk about those things. When you have a woman who uses an IUD and she has a terrific experience with the IUD, and she doesn't have a whole lot of bleeding, or she doesn't have a period for months, and she's great, and she doesn't have to worry about contraception, she gets together with her friends and they talk about it. They're like, oh my gosh, I had this terrific IUD and it's working wonders. Out of the blue, they have that conversation. Men don't do that. Men don't get together and say, hey, man, I got my vasectomy and now I can have sex with my wife, no concerns at all, and it's been wonderful. No, because deep inside in the collective mind of man, in the back of the collective mind of man, there's hidden fear that things might not work the same. And that's not true. Things are going to continue to be the same, except for the fact that you're not going to procreate any children. But we don't like exposing ourselves in front of other men. And that's one of the things that we need to change, because this is normal. We can talk about this without any problem. And we should talk about this without any fear, right? So part of that is that misinformation is because we don't talk about it. Anybody with a working knowledge of anatomy, and I'm talking about anybody who's licensed, a licensed professional, would be able to do a vasectomy, because at the end of the day, vasectomy only means cutting the communication between the cutting the vas deferens. So anybody can do it. The question here is how do you get into the scrotum to do that? Classically, the vasectomy has been done with 2 incisions, one in each side, because the vas deferens, the vas runs on the side of the scrotum, and you do an incision cutting with a scalpel, cutting with a blade, and then get the vas deferens out and cutting. There is another technique, and actually is not necessarily that new, because it was developed in the late 70s by Dr. Li Shiquan from China. It's called the no scalpel technique, which uses a very sharp instrument that actually pokes a hole in the center of the scrotum. And then we spread the skin and use one single opening to actually bring each one of the vas deferens into that opening, and we do the procedure. So that is called the non-scalpel technique. So those are the main variations, but that is only what we do in order to get into the scrotum. There are all the things that happen inside. So once we cut the vas deferens, that's not it, because if we cut the vas deferens and we just put a tie on each side that we cut and send those pieces back in, there's a 14% chances of that failing, meaning 14% chances of having sperm back into the semen, which is not appropriate. It makes condoms much better. So it is important to understand what happens in the inside. And there are multiple different techniques in the inside. The American Urological Association has reviewed the evidence extensively of that. And we do know of 2 particular techniques that have the highest rates of success. It is determined that a technique is highly successful if the failure rate is less than 1%. So one of the techniques, and that's what I do, includes doing a cauterization of one of the segments. So once you cut the vas deferens, there's a piece that is going into the belly, and there's a piece of the vas that goes back into the testicle. The ones that is going up into the belly, we burn it in the inside. We cauterize it with a thermal cautery. And it causes it to be sealed and closed, because the walls of the vas deferens get attached to each other. Then on top of that, we get the tissue that is around the vas deferens and push the vas deferens, that segment that was burned, into that tissue, and we cover it and put a tie or a clip on top of that, basically giving that segment of the vas deferens kind of a permanent condom, so to speak. And then by sending that in, then after that, and then we do nothing with the other segment. If we do that, then the chances of failing are between 0% to 0.5%, which is excellent. The risks associated with vasectomy, the risks are the same as with any other surgery. There's the risk of infection, the risk of pain, the risk of bleeding. So the infection, obviously, that's done under sterile conditions. The risk of pain, we use local anesthetics that actually let you go through the process with no discomfort at all. And I can tell you that from a personal experience. As I said earlier, I did my own vasectomy and I had no issues with that. And the risk of bleeding, obviously, as long as you do it properly, following the technique, and usually with a non-scalpel technique, the reduction of the risk of a hematoma is great. If you do it the scalpel technique, you could expect the rate of hematoma of about 3%, but when you do non-scalpel technique, the rate of a hematoma is less than 1%, so which is a great reduction. There is the risk of what is called congestive epididymitis, which can happen from time to time in some patients. The rates are variable, but in the chronic pain syndrome, chronic post-vasectomy pain syndrome, that can happen, which is persistent pain that lasts more than 3 months after a vasectomy is done. The rates are variable, but are around 1 to 3%. When you look at the rates of post-tubal ligation pain, those rates are higher, or about 7 to 8%. We don't know exactly which patients are going to go that route, but by experience, I can tell you that, because I've seen some patients done elsewhere who have had pain. Usually those patients who have chronic pain have had a really bad experience. Have been those patients who have been basically told to push through the pain during the vasectomy, which is absolutely wrong, or patients who have had complications. It's more likely that a patient who has had developed a hematoma, who has had developed an infection after a vasectomy, ends up with chronic pain. But that's mainly that. Other than that, there are no other, long-term effects from a vasectomy, but the rates are really low. Now, I see people, and I've seen a good number of people who come in and don't want to have children at all. And that's something absolutely, respectable. And I do those. I have, that is perhaps those are the practical reasons, right? For people to come and have a vasectomy. But then when I'm talking with patients, I like to go a little deeper into the reasoning behind their vasectomy, because some of them will tell you things like, I want to have a vasectomy because my wife has had enough. I've heard that. My partner has had enough. She's gone through 3 pregnancies. I've seen her suffer through the pregnancies, or she had complicated pregnancies, and I don't want her to suffer. And what that means to me, and I bring it to the attention of the patient, is that they're doing it because they care for their partner. They love their partner. They're showing, that's a display of how much they care. I've heard, then I don't want to have any more children. And then when I probe more, they say, well, doc, I have 2 kids. The job that I have, it gives me plenty for me to be able to give them everything they need. Another child will make it difficult for me to be able to provide, as much as I can provide now for my children. And then I make them reflect on that. And I say, you see, you're doing the vasectomy, yes, for the practical reasons that you're telling me, but you're actually doing the vasectomy for your children, because you recognize that you need to allocate your resources appropriately for them. So that's the reason. And then you have this person who comes and says, I don't want to have any children because the environment, look at how many of us are in the face of the earth, right? And that person, when you make them reflect, that person is doing his vasectomy because he cares about himself. He cares about the environment. So as we like to say in World Vasectomy Day, we believe and are convinced actually that a vasectomy is an act of love. It's an act of love to your partner. It's an act of love to the children that you have. If you do have children, it's an act of love for the environment. And ultimately, it's an act of love for yourself. A person is eligible to get a vasectomy when the person is an adult capable of making decisions. That's it. It should be that. There should be no other criteria for that. Obviously, if the person has medical conditions that would preclude him from getting the vasectomy at the time he's requesting it, that's different. Say for example, a person has a tumor down in the testicles, well, he needs to get that taken care of before getting the vasectomy, right? Because it would be irresponsible to do it that way. But in general, there should be no restrictions on who can get a vasectomy on that. It has to be an adult capable of making decisions, who understands the nature of the procedure. Back in the 60s, the American College of Obstetricians and Gynecologists had a set of criteria that was completely outrageous. They said that for a man or woman to get a sterilization procedure, their age times the number of children they had to equal 120, which is mind-blowing. And it's written, and they did that without any evidence. Pushing people to have a procedure of sterilization only if they had children. Therefore, for you to be able to have a procedure of sterilization, you had to be 30 and have 4 children already, which is wrong. But no, a person who wants to get a vasectomy, all he needs to do is want to get the vasectomy, understand what the process entails, the permanence of the procedure, and be of a legal age to make decisions on his own. SimpleVas is a clinic dedicated only to the performance of vasectomies, and mainly to make it simpler to get vasectomies for men. I started this clinic devoted only to vasectomies out of my frustration, seeing that men were not participating in reproductive decisions as actively as we could and as we should, actually. Over many years practicing obstetrics and maternal, child, and reproductive health in general, taking care of young families and performing vasectomies, I came to see the difficulties that women were facing when dealing with reproduction in general, and how we have basically dumped on their shoulders all the responsibility of reproduction, leaving men only to participate in the procreation, making babies, basically. And so I got to see from a front row view how difficult it was for women, and how willing they were to take on more things, including a tubal ligation, just not to have any more children when they come to that decision. So I started thinking about the different barriers, frictions, or difficulties in the process of getting a vasectomy for men, and ended up coming up with a model that would make it a kind of like a more streamlined process for a man to get a vasectomy. So the way I designed it was so that patients didn't have to talk to anybody other than the surgeon. And at the end of the day, the only person they talk to is me. So SimpleVas, it was to simplify vasectomies, and that was the reason why I put it together as such, SimpleVas. The mobile clinic it's a different concept. I didn't come up with the idea of the mobile clinic. I stole the idea of the mobile clinic, or I got really interested in building one out of my experience in Mexico in 2017, and the experience with World Vasectomy Day in Indonesia back in 2014, I think. Because in those places, they use mobile units for the promotion of reproductive services. They placing an IUD or placing an implant, subdermal implant, doing consultations for STDs and things like that. They use those. When we were in Mexico at the Plaza de la Revolucion, which is kind of like the national mall in Washington, D.C., kind of big place, big representative place in Mexico City, the Secretary of Health allowed us to use 4 mobile units that they had, and we did vasectomies there. And in one day, we did 130, almost 140 vasectomies. And it was fantastic. I thought it was a terrific idea because it highlights the mobility of vasectomy, something that you don't do with a tubal ligation. I've been in Haiti, and we've been in Haiti in places where it's dirt floor, and we're doing vasectomies in that environment, not on the floor, but on a table that is very well cleaned. And as long as you clean the individual properly, it doesn't matter. You can move the surgeon from place to place. And when I saw that in Mexico, I thought it was a great idea to bring it here to the States, not for the reasons that they have it in Mexico, which is you can transport the surgeon to faraway places to do the procedures because it's difficult to have the surgeons in different places. Here, you can find people doing vasectomies anywhere. Whether or not they do them all the time, that's a different story, but you can find people doing vasectomies everywhere. To me, the idea of bringing that here, highlighting the mobility of the vasectomy, was a terrific idea to so to speak, get out of the closet the discussion of vasectomies. So I was toying around with that idea for 3 years, and finally, my wife, who's a saint, because she finally she said, "Let's just do it," knowing that the return of investment was basically zero because we don't get anything out of that. We built it. Designed it and built it is basically a box that has a bathroom, has a waiting area, and has a procedure room. In patients, I just have different locations in the state that I have agreed on some terms just for parking, but I just go to those places, park. I do it once a month. I travel around the state, park there, and people have signed up for the vasectomies online. And they come and get the vasectomy there. I wanted to learn how to do vasectomies out of an interest in the procedure itself. I learned at a very early age, when I was about 10 or 11 years old, about the power of the word vasectomy. And that was when my mother adamantly demanded that from my father. After my father had an extramarital affair that led to having a child outside of their relationship, and judging by the expression of my father on his face and the reaction, I without knowing exactly what it meant at that early age, I realized that it had a lot of power, that word. So I was very interested. So when I went to medical school, I learned obviously what it meant, but to me it seemed like for me to be able to do that, I had to get into a urology, and that was not necessarily something I was interested in. Eventually, when I was in residency, I did my residency initially in family medicine, and then I did a 2-year fellowship in maternal and child health. I realized that vasectomies worldwide are actually mainly done by family doctors, because it's a primary care intervention. It shouldn't be a super specialized intervention. So I wanted to get trained, and I was trained in the East Coast. And it turns out training in the East Coast, it could be very malignant for many family physicians who want to have a broader scope of practice. It was interesting because I got to get my surgical training and doing cesarean sections and all that in the East Coast. I was at Brown University in Providence. But the interesting thing was that many times during residency and fellowship, when I asked to be trained in vasectomies, didn't get that. And I got a lot of pushback. Oh, no, you're not, we're not going to train you. So it wasn't until after I was done that I started looking for someone to learn with. And I came across this wonderful person, Douglas Stein. He's a urologist in Florida, who only does vasectomies. He stopped doing general urology, I think, about 25 years ago. And all he does is vasectomies. He does about 2,500 vasectomies per year. And I want to learn, with him. And I saw that he had a lot of work with a nonprofit called Non-Scalpel Vasectomy International, and literally got hooked on the whole movement of promoting the vasectomies. When I'm in the mobile clinic and you see the reaction of people when I'm driving in an interstate, and you see that truck drivers, minivans, guys in their vehicles by themselves in their trucks drive by, and they slow down and they don't want to pass me because they're reading everything that is written around the mobile unit, and then they honk at you or they give you the thumbs up and a big smile. I know we're creating that discussion. People are taking pictures. I stop at a gas station to pump gas in the truck, And then people come around and say, is that for humans? I'm like, yeah. And then you start having that conversation. That is wonderful. And people take pictures and they upload them in social media, and they make jokes about that, and they call it names, the nutcracker, the castration device, whatever it is. And it's wrong. Obviously, many of these assumptions are wrong. But the fact that they are talking about them, the fact that they're making jokes about it, the fact that there are people actually making serious comments about it, I think it's great, because we can change that. I am in this mission of doing vasectomies for the reasons that many of us who are doing it are, right? But what I have a particular passion in one aspect. Many of us understand that this is a matter of equity and equality in terms of reproductive decisions and reproductive rights. Many of us understand that it's an environmental matter, right? It's 7.8, almost 8 billion people on the face of the earth. There's too many of us already. And we need to be more conscientious, more aware of what we're doing with the environment. So that's one of the reasons why we do it. Some of the people do it for the sake of the academic aspect of teaching this and bringing this to other places. In my particular case, what drives my passion highly is the reproductive rights. I got tired of seeing how very little participation men have in reproduction when we have a clear option here. Certainly, we don't have many options in terms of what we can do. We have only condoms and we have vasectomies. And I personally think that when birth control pills for men finally make it out, they have to have zero side effects, because men will not put up with even 30% of the side effects that women put up with when they take birth control pills, because we don't have the same type of investment that women have in a pregnancy, because we have no idea what it is to be pregnant, and we will never figure out what it is to be pregnant, because even if a woman has never been pregnant, she knows that her body is going to change. We have no idea what that is. So then we don't have that kind of investment. So to me, it's a matter of equality. It's a matter of equity in terms of reproduction. So that's what drives me. So when I think about that, I'm thinking about shifting the relationship between tubal ligations and vasectomies. And just to give you an example, in the state of Iowa, over the past 4 years, according to the Iowa Hospital Association, there were 8,500 tubal ligations done throughout the state. And when you look at the map of the state, which has 99 counties, you see that the distribution of the tubal ligations is pretty much throughout the entire state. But then over the same period of time, the number of vasectomies that were done were only 4,500. 18,500 tubal ligations versus 4,500 vasectomies. There's a huge discrepancy. That's a big gap in terms of the participation. And when you look at the map of the counties, you see a concentration of vasectomies just in a certain area around the University of Iowa, which is the big medical center in the state. That is not right. That is not correct. And it's even worse than the rest of the United States. In the United States, because what that means is for every vasectomy that we do in the state of Iowa, there are 4.5 tubal ligations done at the same time. Whereas in the United States, for every vasectomy that is done, there are three tubal ligations done. It sounds bad, but it certainly is not as terrible as other countries. And I'm ready, as I have mentioned probably before, I'm ready to travel overseas next week. And I'm going to Ecuador. In South America, in Ecuador, for every vasectomy that gets done, there are 35 tubal ligations done. So that huge gap can be closed. According to United Nations in 2019, there were 219 million tubal ligations done worldwide, whereas only 16 million vasectomies were done worldwide. The relationship is 1-7. That is wrong. That is wrong when if you go down to the basics of money for Ministry of Health, the amount of money that is spent worldwide and 219 million tubal ligations, considering that they need an anesthesiologist, an OR, and more stuff than to do a vasectomy is too much. If instead of doing 219 million tubal ligations, we're doing 200 million vasectomies, that is way cheaper. Even if you think only about money, which is what we do when we go to a Ministry of Health in another country with World Vasectomy Day, we talk about money so that they listen, right? But in terms of pure equality, reproductive equality, reproductive equity, the gap is huge, is really big. And it's not that we don't have examples of something different. When you go up north to Canada, the relationship is completely flipped. For every tubal ligation done in Canada, there are 2 vasectomies done. So we can actually change that. And that's why I firmly believe that I can do that. I can spearhead that in the state of Iowa as a nice laboratory. You know, it's 3.3 million people in the state of Iowa, give or take. And we can change that relationship of 1 to 4.5 to at least 1 to 1. I'm not saying that tubal ligations are necessarily evil when it comes to making a decision for no more children, but I find hard to believe that there is an indication for a tubal ligation other than either a woman is in a C-section and her belly is open already and she has the surgery, or a woman is by herself and she doesn't have the alternative of vasectomy. You know, she's had a child or 2 children or no children at all, and she just doesn't want to have any more children or no children at all. And then she gets to make that decision herself, which should be respected. But other than that, if there's an alternative, which is the vasectomy, there's no reason for a woman to go through that. Very, very rarely I get somebody who criticizes the vasectomy. You know, they have not done it necessarily on my face. It's been more social media and say things like, oh, I wouldn't go there and get a vasectomy or get a procedure like that, get a surgery on a mobile, on a trailer or something like that, they say, which highlights the hypocrisy that we have, because we complain about the red tape in the healthcare system. You know, how many blocks we have to get to, or how many different people we have to get into to talk to the surgeon, right? But when you have direct access to the surgeon, then you don't like it. We talk about how annoying it is to go to the ivory tower of the hospital because everything is complex and everything is very, very expensive. But when you bring it down and simplify it and put it in a mobile unit in a safe way, I'm not talking about doing this in the back of a pickup truck. It is a mobile unit. It's an office, but it's on wheels. When you show that, then people are like, no, I don't want to do that. So people want simplicity, yet they demand the red carpet treatment. And they just assume that this is a third world country type of treatment. And it's not that. This is a way to show how mobile a vasectomy is, how simple it is that you can take it from place to place without needing major infrastructure, which is what you need if you're going to do a tubal ligation. That's a big difference. All I want to say in terms of what Stop Having Kids is doing is that I think it is very important to bring awareness to the fact that we need to think about the choices that we make. We think about, in many cases, we think about choices that are not as relevant and as important as having children. We stop and think about buying a vehicle, buying a car, going to college, the professional path that we take. And it turns out bringing a life to this world, is one of the biggest, if not the biggest thing that we could do with the biggest impact that we can have. It is important that we stop and think what we're doing with that. You know, whether a person wants to have a child or not, procreate a child, it's the individual's prerogative and the individual's decision. But we have to stop and think about that, the implications of that, the commitment, the impact, not only the social, the social and emotional impact, the environmental impact. That's the message that I want to leave, that it is important that we realize that reproducing, which is a highly complex task that what we're given the ability to do has to be considered before we use it. You know, that's a major power. Do you really want to use that power? And if you're going to use it, how responsible are you going to be when you choose to do it? That's what I want to say.